Good day and welcome to today's DPI update. As usual, we're here with Minister of Health, Honorable Dr. Frank Anthony. Minister Anthony, welcome again to today's DPI update and thank you for joining us.
Well, thank you very much for having me once again.
As has been happening for the past quite a number of days actually, St. Cuthbert's mission has been engaging national attention. So can you give us an update on the numbers and how things are progressing as regards the operations of the ministry?
Well, I think from a medical side, we have sent in a team to St. Cuthbert's. They remain in St. Cuthbert's and they've been working with the residents there. You would recall last week sometime we had about 269 cases. Right now we are down to about 153 cases. We continue to do testing, and over the last 24 hours we found maybe 2 additional persons who were positive. So, we'll continue to monitor tests, and once we identify positive people, we would isolate them and take the necessary precautions. The good thing so far is that most of the people there have been asymptomatic, but however, when you test them, you're finding that they're positive. I think we've had 2 cases of persons with mild symptoms, and they have been monitored by the team that is in St. Cuthbert's. So I think so far we've been making good progress. We've had another team that went around the community talking to people, helping them with health education pertaining to COVID, and also we've had a sanitization team that work with the residents in terms of how to sanitize their places of work and where they're living. So I think those things have helped to curb the spread, and we continue to work with the village council and the leadership there to ensure that people understand why they need to take precautions such as wearing masks and doing social distancing. So I think we're gradually getting better compliance, and of course we are also collaborating with the joint services who have assisted us in a number of ways in terms of the lockdown. From a government point of view as well, because we recognize the challenges that people would have when you're confining them to their residence. They would not be able to work, and therefore they'll have challenges in terms of getting money and getting foodstuff. So early in the week we had the CDC went in and for the second time distributed hampers. So hopefully those who were confined to their homes, they would be able to get foodstuff for their meals.
So cases are going down, which is a very positive sign. Hampers, I know, have been distributed a second time. Does the lockdown look like it will be extended, or you think it's too early to make a judgment call?
Well, it's a little bit too early, let's see, because as we continue to test, if we find new cases, obviously we might have to extend. But given the cases that we discovered last week, I anticipate in 10 days' time that those numbers would drop as well. So we'll observe and see what happens. I don't want to make premature announcements, so let's see how the dynamics of the disease evolves in St. Cuthbert's.
Moving on to talk as well now about the whole question of the vaccine. I know you've had a recent meeting involving being a part of COVAX, and also the news globally is buzzing now about at least maybe 2 or 3 possible vaccines that could be ready in another month or 2 months' time. One recently talked about being available by Christmas. Can you give us an update on those global vaccines that possibly could be ready soon?
Well, I think the vaccines that are making a stir is really what is called the mRNA vaccines. The first one that we heard about was from Pfizer and BioNTech. BioNTech is a German company, so that was the first one that we heard about. Initially, when they release information pertaining to the efficacy of the vaccine, they had said that those vaccines were 91% efficacious. Now that they have completed the testing and did the final analysis, on the 18th of November, they released the data to show that it's now 95% efficacious, which is good. The challenge, however, with the Pfizer vaccine is that you would require to have what is called an ultra cold chain, and meaning that those vaccines would have to be stored at minus 80 degrees Celsius. So that can be challenging because most countries do not have that type of cold chain arrangement. We certainly do not have it, but if we're going to utilize those vaccines, then we'll have to build out that type of cold chain network. We have, as I said, been exploring the possibility of doing so, and that is something that we are still continuing to investigate. The second vaccine, which was by Moderna, that one has also shown very promising results with about 94.6% efficacy. And, but they are also not in we haven't seen the final analysis yet. So when that is available, I don't know if it would go up some more, but again, that's very promising. Now, that particular one would use normal refrigeration temperature, so you do not require this ultra cold chain to store vaccines. So the second one looks even more promising for developing countries. Now, both of these still have some challenges because for you to use them, they would have to apply in the United States to the FDA, and they're hoping that in the coming days that such an application would be made, and that the FDA, having having gone through the documentation that is presented, that these vaccines would probably get what is called an emergency use authorization. So if they get that, then they'll proceed to the next phase of manufacturing. So we're still a little bit off from getting it. I saw one article that reported Pfizer saying that they can do about 50 million doses by the end of the year, and later on they'll do some more doses in the coming year. So for us, it's going to be challenging to get any of those vaccines within this year, because as those vaccines are produced, I think the bigger countries would certainly take them very quickly, and it would be difficult for us to access them because of the relatively small quantities that would be available by the end of the year.
Are there any other outcomes or details which may have arisen from your meeting with the COVAX entity? I know some of the surrounding entities you have mentioned before as well.
The COVAX meeting, we had a very extensive meeting this morning with 92 countries from around the world who would be benefiting from COVAX AMC. That is, these 92 countries were identified by COVAX, and the idea is that Gavi would be assisting in raising funding for these countries so that the cost per vaccine would be very minimal. And so it was a discussion this morning with those countries pertaining to quantum of vaccines, type of vaccines, what are the candidates that we are looking at, when can we expect these vaccines to become available, what stage of development they're in, and a whole host of things. So, and also what we looked at is putting in place governance structure, how countries who are participating in this can also get their voices heard. And so it was a very detailed meeting, and I think from those deliberations, it has helped to guide the Gavi and the other key players in COVAX, CEPI and WHO on a way forward, especially for these countries who have been involved in the discussions. We have some obligations, we have some timelines, some of which we'll have to complete before the year is over. These include doing preparation in terms of rollout of vaccines when they become available, looking at our cold chain, making those assessments, strengthening the cold chain, training people to administer them. So there's a whole host of things that we got to do to make ourselves ready so that when these vaccines are available, we can easily roll them out. So this would be an ongoing process because while COVAX is really an innovation in terms of financing research and getting it to getting vaccines to be manufactured quickly, they're also working with the countries to make sure that they have the infrastructure and ready themselves to quickly deploy these vaccines once they're available. So it's a lot of work, but I guess in the end, it's heartening to everyone. If we can get a safe vaccine out to people, we'll be able to quickly contain this pandemic.
Relatedly, not too long ago, you did mention an implementation team or a specialized team from the ministry. Are you able now to say perhaps the composition of the team and maybe how big it will be when it comes to the rollout of the vaccines in Guyana?
Well, by next week, we'll announce the members of the team. We have been working on that. We have both people from ministries, from the private sector, from the some technical experts who would be working with us. So by next week, you'll hear the team from the task force, basically, that has been set up to look at vaccines.
We haven't touched much recently on testing and testing capacity. I know it was in a crisis only 2 or 3 months ago, and the ministry was not at the level at which it wanted to be. Where is testing right now, and what is the capacity like?
Well, in terms of PCR testing, we have the National Public Health Reference Lab, and we have the capacity now to do between 450 to 600 tests per day. We are going to increase that. I aim to get that up maybe to about 1,000 to 1,200 tests per day or even more. So we are building a lot of capacity to do PCR testing. In addition to what we are doing, you have in the private sector, you have Eureka Lab that is offering testing, and you have some other private sector players who are now developing their capacities. So very shortly you will have some other maybe labs that would be coming on board to be able to offer PCR testing. Some of those facilities have indicated to the ministry, and right now they're going through a process of screening so that we can ensure that they have all the different processes and the equipment and personnel to be able to offer this type of testing. So that's with PCR testing. In addition to that, we would also be utilizing rapid test kits. We have ordered, and very shortly we will be receiving. So by the end of this week, from the government standpoint, we would also be utilizing rapid antigen test kits. And so we'll probably receive the first set of such kits during this week, and by next week we'll roll them out. Those are much cheaper, and we will be utilizing maybe, I think the first batch we're probably looking at about 20,000, and we have on order several more thousands to come in. So we'll have adequate rapid antigen test kits which would be deployed, and these kits would be used in conjunction with the PCR. So we'll have enough to test quite a lot of people. So testing shouldn't be a problem anymore. And as we know, these kits can help us to determine whether somebody is infectious or contagious.
Relatedly, as regards testing, the airport, of course, came in for some increased attention, given that passengers from overseas were returning or visiting, as the case may be. Can you give us an update on the numbers and how is that process moving? Persons I know who have a test that's more than 72 hours old have to be retested.
Yeah.
Comment on that.
So our policy is that if you're coming into Guyana, if you have a PCR test done within 72 hours, then we wouldn't retest you at the airport. If it's beyond 72 hours, when you come in, you're required to do a second test. And that second test is being provided by the private sector, and the cost is being borne by the passenger. If you were able to do it within your 72 hour, then there's no additional cost, and you're able to go. Since we have started that program, the provider of those tests, I think they probably would have completed more than 1,000 tests, and among those persons who have been tested, we have found 11 persons who have been positive. So we keep monitoring. Once we detect a positive person, our staff, they have an obligation to do several things. One, we have to do contact tracing for all the persons who these passengers would have been in contact with. On the flight coming, where they've been sitting, the passengers that sat around them would have to be informed, both in front, the side, and the back. And so we are able to do that as well. And thirdly, by our international obligation and agreements that we have regarding international health regulations, we are obligated to tell the country of origin that this passenger has tested positive. So we have been utilizing these systems and informing our counterparts in other countries about the cases that have been imported so far.
Christmas is in the air, but so is COVID-19 still. Any projections you can talk about what the ministry might be putting in place? Greater enforcement maybe, more ministerial outreaches as part of COVID Corp? What can you tell Guyanese at this time?
Well, what I can tell Guyanese is that we haven't seen an application for vacation leave from COVID-19, right? So COVID-19 is still here, and it's not going anywhere too soon. So if we are going to let down our guard, if we're not going to wear a mask, if we don't want to do social distancing, then a lot of people are going to get infected. It's simple as that. And we know that traditionally that people tend to increase their socialization during Christmas. People tend to increase their drinking during Christmas. People want to have family and friends over for Christmas. Those things in a pandemic should not be allowed. And if you want to remain safe, then you should use the common sense knowledge that we all have and ask your friends and family to hold on. They don't need to come over this Christmas. You don't need to go out and have a drink this Christmas, right? Abide by these rules. Who knows, it would be able to save your life. Because for some people, they would get sick. They would come to the hospital. They would end up in the ICU. And they can be battling for their life. So I just want people to understand that. In other countries, people are taking this thing more seriously. And people are abiding by those rules, right? And because they're abiding by those rules, they are able to reduce infections in their country. This effort that we have that is ongoing. It's not a Ministry of Health effort. This has to be a national effort if we are going to keep our country safe. If we are going to keep our citizens safe, it's got to be a national effort. And, you know, the weakest link would be those persons who don't want to abide. And therefore, we have to encourage them. When we see such behavior, we have to encourage them to abide by the rules that we have. And that's the only way we'll stay safe. And Christmas is certainly not a time when we can let down our guard.
Minister Anthony, thank you very much for your time on today's TPI update.
Thank you very much.